Hello. This is for the second part of the chapter 29 notes. This is first we're going to talk about major events in fetal stage of development. Here is one of the models from my room of a fetal stage of development. This is 5 months of pregnancy. The head is usually down. This light blue represents the placenta. And then outside of it is, of course, the uterus. You can see the ovaries and the tubes in relation to the ovaries. So that the uterus is growing up into the abdominal area. So we're going to talk about some hormones related and what's going on in the woman's body as well. So the fetal period is from the beginning of the 3rd month into birth. So right after the embryonic period, we're going to have maturation of the tissues and organs, because everything is pretty much there in the embryos at the end of the embryo stage, but things need to get bigger and get more mature. So there's going to be rapid growth. And for example, at the end of the embryo stage, 2.5 centimeters, and at birth it's 53 centimeters, so quite a bit of growth. And then especially there's a lot of weight gain in the last few months. So if you've ever seen a preemie baby, they actually look quite skinny, like their skin looks wrinkly because they haven't put on the fat yet, like they should have in utero. And then your book has, in table 29.3, major events that happen in the different timelines, and we'll talk about those in class, major things that happen. So one thing, clinical view, that we should talk about is what happens if couples are infertile or they're having problems getting pregnant. Now, first of all, there's a lot of reasons that can cause this. Technically, though, infertility, I believe it's if a couple is actively trying for over a year without any, obviously, contraceptives, and they can't get pregnant, then that would be a reason to check to see what's going on, see what kind of fertility issues they're having. This doesn't include miscarriage, like a woman that keeps getting pregnant but keeps losing the baby. That would be some different kind of tests. So infertility is inability to conceive and then maintain a pregnancy. And there's multiple causes. So one of them is the uterine tubes could be blocked, and there's different visualizations that can look at that. Sometimes a disease called pelvic inflammatory disease or endometriosis can cause that. Overgrowth of that endometrium. Different ovulation disorders, maybe don't ovulate correctly. Some women can actually have anti-sperm antibodies that attack, or even a low sperm count for men, or different problems with the sperm. That means abnormal. And then there's different treatments. There could be depositing of sperm through a device rather than penis. Different medications. This is showing in vitro fertilization. This is in a lab, essentially taking the egg from the woman, sperm from the guy, and growing the fertilized eggs in a lab and then implanting them into the uterus. There's even donor eggs that are available. Okay, so again, we're going to talk about hormones, what's happening to the woman's body during pregnancy, those few things. So pregnancy is 9 months. And those 9 months can be divided up into trimester, 1st, 2nd, 3rd. First 3 months, 2nd 3 months, 3rd 3 months. So the 3rd trimester is the 7 to 9 months of pregnancy. This is where there's really rapid growth, rapid weight gain. Sorry, it's pausing. So their pregnancy can vary from woman to woman. I've heard some women say that pregnancy was just a joy the whole time through. I've heard other women say it was the hardest 9 months of their life physically. So it does vary. Varies whether or not people get morning sickness, whether they gain weight or how much they gain, and the length of pregnancy when they go into labor, essentially. And even the same woman, I've had 3 pregnancies. All 3 have been different. Estrogen and progesterone, we've talked about how these hormones are crucial to building the uterine lining, okay? So during the first 3 months of pregnancy, the 1st trimester, the corpus luteum, that degenerating follicle, produces them. But then after that, there's a period of time where the placenta, that's your word here, takes over in producing those hormones. And you do need those hormones to keep increasing throughout pregnancy to maintain the pregnancy. What they do is they suppress follicle-stimulating hormone or luteinizing hormone. And then they help the uterus enlarge, the mammary glands enlarge, fetus to grow. It also creates fuller hair and stronger nails. Some women say that their skin was the best when they were pregnant. It also relaxes your joints to prepare for pregnancy. So, like you feel like actually, especially in your hip, you feel like you're unhinged almost. Other hormones, those were two very important ones. Other hormones, relaxin, actually promotes blood vessel growth in the uterus. CRH helps, there's a few things it does, but your placenta secretes it. It has a role in timing of childbirth and length of pregnancy, but although that role isn't well understood. And then lastly, this is important, it causes a rise in aldosterone, which causes a woman to hold on to fluid, excess fluid. This is why I experience, and most women experience, edema in pregnancy or swollen parts of your body, like your feet and your fingers. I couldn't wear my wedding ring towards the end. Prolactin is another important hormone that increases 10 times during pregnancy, produced by the anterior pituitary, and this ensures that lactation after you give birth starts happening. Lactation is producing milk. Related to prolactin is a hormone called oxytocin. This causes the release of milk. It also causes uterine contractions. And it's elevated in the second and third trimesters. So, this is the uterus without the baby in it. Okay, it's not, took the baby out, okay? So during pregnancy, it expands tremendously. By 12 weeks, it's just superior to the pubic symphysis, so not very big. But it does start to impinge on the space of the bladder, the urinary bladder. This causes more frequent urination, also just generally increased blood volume, causes increased urination. By 22 weeks of pregnancy, it's at your umbilical cord. The uterus is all the way up there to your belly button. Lastly, by the 9th month, full term, the uterus is the top of it, the fundus. So the top of the uterus is all the way up to the xiphoid process of the sternum, so right there. And this compresses things, makes it, again, you have to go to the bathroom, can cause gastrointestinal issues like constipation. Another thing that happens when you're pregnant is developments in your mammary tissue. You start to feel it in your first trimester. They get tender. They actually increase in size right away. And this is due to the increasing levels of estrogen and progesterone. Okay. Another hormone that's going to influence breast tissue is called melanocyte stimulating hormone. Remember, melanocytes are responsible for eye color, skin color, hair color, but in the placenta also secretes this hormone, and it causes the areola around the nipples to become darker. And then it develops, normally you don't have a colored line right here, it's called linea alba, but when you're pregnant, the line darkens.